The video you are about to watch will help you feel more confident living with heart failure so that you can control your symptoms and improve your quality of life. This video will help you understand what heart failure is and how to manage it with 5 daily checks using the heart failure plan every day. Heart failure is when the heart is not able to pump as strongly as it should. Because of this, the heart is not able to pump the right amount of blood, nutrients, and oxygen throughout your body. Heart failure is caused by many different factors. Some of the most common causes include heart problems such as high blood pressure, heart attack, and weak heart valves, a family history of heart disease, lung conditions such as COPD, sleep apnea, and kidney disease. Lifestyle factors that can affect heart failure include inactivity and obesity, smoking, excessive use of alcohol and drugs. Why is self-management important? Learning to manage your heart failure will allow you to have an improved quality of life, prevent or limit heart failure complications as the disease progresses by making self-management a habit rather than a chore, reduce your need to go to the hospital by knowing when to seek help before you become acutely ill, improve communication between you and your healthcare team, and improve your own understanding of heart failure so you are able to seek support from your family and friends. The key to treatment is in your hands. By following 5 daily checks, you can greatly reduce your risk of experiencing the negative effects of heart failure. One of these checks includes taking your medication at the same time every day and making sure not to skip doses. If you are experiencing negative side effects, contact your doctor as soon as possible, but do not stop taking your medications. Doing this will ensure you have the right amount of medication in your system to keep your heart working to the best of its ability. Another daily check to help maintain control of your heart failure is to keep track of your daily fluid intake. Drinking too much fluid can cause your body to hold water in places such as your feet, legs, and belly. This puts extra pressure on your heart as it has to work much harder. Extra fluid can also build up in your lungs, making it harder for you to breathe, even at rest. At times you may feel thirsty, but gradually your body will adjust. Some things you can do to deal with your thirst include rinsing your mouth with water often but not swallowing, snacking on frozen fruit such as grapes, and chewing sugar-free gum. Limit yourself to 6 to 8 cups of fluid each day. This is equal to 1,500 to 2,000 mils. A fluid is any food or drink that is liquid at room temperature, such as soup, coffee, tea, water, fruit juices, ice cream, jello, honey and syrups, and liquid meal supplements such as Boost. You can help reduce your fluid intake by using small cups or glasses, sipping your fluids slowly, recording your intake of fluids each day, using a water bottle with measurements, and being aware of foods with high water content such as watermelon, yogurt, and pudding. Try not to drink alcohol. Alcohol dehydrates your body and makes you more thirsty. It is also important to limit how much salt you eat. Only 1 teaspoon of salt contains over 2,300 milligrams of sodium. Your body needs some salt, about 2,000 milligrams per day. Consuming more than this can cause your body to hold on to water. Fluid and salt restriction go hand in hand. Too much salt in the body draws extra fluid into the feet, legs, belly, and lungs, causing swelling. This fluid buildup in your body will cause your heart to work harder and will cause you to have trouble breathing. You can control your daily salt intake by eating fresh foods and preparing home-cooked meals. Avoid canned and processed foods, pickled items, and deli meats as those contain high levels of sodium, known as hidden salts. Also, try not to eat out at restaurants too often, as more than half of all sodium intake comes from restaurant meals and processed foods. To avoid the temptation of using excess salt, remove any salt shakers you have from the table. Read food labels on groceries for salt content before purchasing them, and choose low sodium options if available. Remember to consult your healthcare provider before using a salt substitute to ensure that it is safe for you. If you have any questions regarding your diet, ask your doctor for a referral to a registered dietitian or call 811 to speak to one. Lastly, it is important to check for swelling every day in your feet, ankles, legs, and belly. You can do this by pressing down on your skin and looking to see if an indentation is left. An indentation indicates that you may have fluid buildup in your body. The very best way to monitor for excess fluid is by weighing yourself while wearing the same clothes and using the same scale on a hard surface, not carpet, at the same time each morning before your breakfast. Empty your bladder before weighing yourself to obtain an accurate reading. Track your weight in a notebook and watch for your pants, belts, or shoes feeling tighter. Report any sudden weight gain of over 4 pounds in 2 days or 5 pounds in 1 week to your doctor. This is urgent. Your healthcare provider may have provided you with the My Heart Failure Plan reference guide. You can refer to it daily to help you remember the important self-management recommendations outlined in this video. The plan is also designed to help you recognize which zone your symptoms fall under and lets you know what actions to take in response. Get to know the different zones so that you can take action. The safe zone. This zone means that you are not currently experiencing the signs and symptoms of heart failure. This means you have no shortness of breath or you are at your usual level, no chest discomfort, pressure, or pain, no swelling or no increase in swelling in your feet, ankles, or legs, and no weight gain of more than 4 pounds in 2 days or 5 pounds in 1 week. As the name suggests, the safe zone means that you are not at risk. You should continue to take your medications regularly and continue with the daily checks mentioned earlier. The caution zone. The caution zone means that you are experiencing one or more of the following symptoms: more shortness of breath than usual and find it harder to breathe when lying down, have not slept well and are waking up because your breathing is more difficult, have an increase in swelling in your feet, ankles, legs, or belly, have gained more than 4 pounds in 2 days or 5 pounds in 1 week. These symptoms are urgent. Phone your doctor right away for an appointment. If you find that you are in the caution zone, you should call to see your doctor right away. If unable to reach your doctor, call 811, the BC Nurse Line, and speak with a nurse. Following these steps will help to prevent your symptoms from worsening and will reduce your risk of being hospitalized. The danger zone. The danger zone means that you have one or more of the following symptoms. You are struggling to breathe, have a fast heartbeat that does not slow down with rest, have chest pain, or having trouble thinking clearly. The danger zone means that you must act fast. Call or have someone else nearby call 911 for an ambulance to take you to the hospital. Calling 911 as soon as symptoms appear will ensure that you receive timely medical attention to keep you safe. Remember, the most effective key to treatment is you. Do your 5 daily checks to know which heart failure zone you are in. Use a heart failure plan to guide you. You are not alone in managing your heart failure. Family, friends, your healthcare team, and community services can give you the support you need to manage your heart failure.